Hi, I'm Ann Levin, and I'm going to talk about scaling up costing. The purpose of this presentation is to help you understand our approach to costing for scale up of screening and treatment services. I will talk about the objective of this type of costing, what costing is, and how it differs from cost effectiveness analysis, and I'll present the costing methods that we use in the costing tool. The objectives of scale-up costing in the C4P are threefold. First, to estimate incremental or additional costs of scaling up national screening and treatment over 5 years. Second, assist in program planning, that is, to think through the resources required for scaling up the program. And third, to evaluate the cost of differing scenarios for screening and treatment. Now I would like to explain what the tool can and cannot do. That is, it focuses on conducting cost analysis and not estimating cost effectiveness of interventions. Specifically, costs are defined as the value of resources employed for goods or services, such as the cost of a screening service. So the C4P, for its cost analysis, estimates the incremental costs of scaling up screening and treatment in a country. That is, it projects the additional costs of improvements to the program. The cost estimates are used to identify cost drivers of the program, assist in planning, decision-making on allocation of resources and advocacy, and analysis of affordability and budget allocation. The C4P does not conduct cost-effectiveness analysis. Cost-effectiveness analysis compares the costs and outcomes of two interventions that have similar outcomes. Thus, it requires outcome measures such as deaths averted, which are not provided by the C4P. This type of analysis is used for decision-making when deciding between two interventions or strategies, but cost-effectiveness analysis does not provide information on affordability and budget allocation. However, the C4P does provide this information. Similarly, the C4P also does not conduct cost-benefit analysis. This type of analysis compares costs to benefits, and the benefits are monetarized. That is, the user has to determine what the monetary amount that the benefits are worth. For example, what's the cost of treatment that is saved when a life is saved? Cost-benefit analysis aids in advocacy and decision-making on interventions. However, it also does not provide analysis of affordability and budget allocation, such as you would get from the C4P. So CEA and CBA do assist in decision-making, but not an analysis of affordability of budget allocation. They also require separate models to estimate the reduction in lives lost or the monetarized benefits. Now I'm going to talk about our approach to costing in the C4P. In our approach to costing, the ingredients approach is used when data are available. The ingredients approach is a bottom-up approach that implements detailed costing to estimate the value of resources or ingredients used for screening and treatment by multiplying prices by quantities. However, sometimes these data are not available, so the tool also provides the option of using the expenditure approach to estimate the cost of an activity without ingredients costing. So in that case, the user would put in the cost of an activity, such as training, when data are not available. The C4P uses the government perspective for the analysis. That is, it calculates the cost to the government of screening and treatment program in its financial costs. It does not calculate the cost, for example, societal costs. It also estimates the cost at the activity level. That is, it first the user identifies the activities to provide screening and treatment services, for example, a screening service, and then they would estimate the value of the resources used for each activity, for example, supplies or equipment or whatever is used for that activity. The C4P differentiates two types of costs: financial and economic costs, and recurrent and capital costs. Financial costs are the monetary outlays on goods and services. It includes all resources purchased by the government, but does not include any in-kind costs that were not purchased. For example, donated items and volunteer time. It only includes the labor costs of health personnel that are not already paid for by the government, such as new employee time. The economic costs, on the other hand, in addition to financial costs, include the value of all resources used, regardless of the source of financing. So they include the opportunity costs of resources such as health personnel time, donated resources, and volunteer time. This figure shows the relationship between financial and economic costs. It indicates that financial costs are a subset of economic costs. Note that economic costs should be used in cost effectiveness and cost benefit analyses, since these value all resources employed for screening and treatment. Another way that costs are differentiated in the tool is recurrent versus capital. Recurrent costs are for resources or activities that last less than a year. It includes, for example, the cost of a service such as screening. Capital costs, on the other hand, include resources or activities that last longer than a year. These include the cost of one-time only events, such as microplanning and training, and these are what we call introduction costs. It also includes investment in equipment, vehicles, and buildings for screening and treatment. The analysis of capital costs differs from recurrent costs in that these are annualized and amortized, so that costs can be spread over the period of the project. Our approach to scaling up costing in the C4P allows the program manager or analyst to calculate costs of scaling up their screening and treatment program. This estimation will allow them to determine which activities are the cost drivers, that is, which activities cost the most. C4P also provides transparency and assumptions used in the analysis so that these can be modified easily. In addition, the user or analyst can estimate the cost of different scenarios for scaling up the program so that they can assess the affordability of each of these to the program.